The latest COVID-19 numbers show another nearly 3,400 cases and 28 more deaths. Governor Tim Walz says he's taking immediate action to free up hospital beds and scale up rapid testing. The National Guard will play a role in that process. WCCO's Caroline Cummings breaks down what those plans include for us. Caroline.
Hi there, Shayla. The National Guard has played an essential role in fighting the pandemic across the country and including here in Minnesota. And now as cases are continuing to rise because of Delta, and so too are hospital beds filling up, they're being asked to call to action again, this time to help with testing and in long-term care facilities where there are suffering from workforce shortages. Now, hospitals say many of their beds are occupied by patients who should be treated in long-term care type settings, but can't because those beds are full and there aren't enough staff to tend to them. Walz says there are about 400 patients that should be discharged and could free up some of those beds. A yet to be determined number of National Guardsmen will get trained and provide staff support to these facilities, which will then in turn free up those beds. Walz will also reactivate the COVID emergency staffing pool. And hospital leaders here at North Memorial implored Minnesotans to get vaccinated. Their staff numbers are also shrinking, and those that are working to take care for people are exhausted. 96% of COVID ICU patients at North Memorial are unvaccinated.
And if we are unwilling to do the things necessary to slow the spread of COVID, that will be exacerbated until you reach crisis situations like the state of Alaska, the state of Montana, the state of Idaho ended up in, where they have to make the horrific decisions of telling some people they can't come in because we've got no space for them.
Now, the National Guard will also assist with new COVID testing sites with rapid testing. Some of those will be in Stillwater, Hutchinson, and Crookston, with a few more yet to be announced next week. And Shayla, Governor Walz is also asking the state legislature to take action with policies to help with this pandemic. Shayla.
Important information. Thank you so much, Caroline. The talk on booster shots continues as an outside FDA panel of advisors plans to vote on Johnson & Johnson's vaccine for emergency use. Yesterday, the panel voted to recommend Moderna's smaller dose booster for Americans over 65 or at a high risk. Now they will decide if some Americans who already received Johnson & Johnson's one dose could benefit from a second.
We want to provide optimal protection against COVID, and we know that a booster dose will do that.
Pfizer's booster was first approved for seniors and high-risk individuals. According to the CDC, more than 9 million Americans have received a booster. Today, the group of experts also hear data on if mixing vaccines from different manufacturers for a booster is safe.